Hey, folks, it is Chad Duplantis with Dentist in the Know, and it's always an honor to be here. We're at Chicago Midwinter. We have our booth set up. It's a lot of fun because we see friendly faces, but I'm about to introduce you to one of the friendliest faces in dentistry. There's a lot of people that we've grown to connect with, and there's people that just we're happy to see them every time we see them. And that would be David Rice. I'm teasing. No.
He's mine too.
Yeah, no, I'm teasing. Actually, it's really one of my favorite people in dentistry, Dr. Pamela Maragliano Muniz. And I think I might have butchered it a little bit. We worked on pronunciation because it always throws me off. But Pam, it's so great to see you. Thank you so much for being here. And how are you doing?
I'm doing great. This has been a fun conference, been busy so far, lots of meetings, lots of videos, and it's been good.
So before we start, are you lecturing at this conference?
I am not. I was on a panel discussion yesterday, so pressure's off. I'm just chilling.
A panel discussion for Chicago Midwinter?
No, it was actually, so you should talk to Marty Jablow. He organized the Dental VIP Summit.
Oh, I saw that yesterday.
Innovation and Partnership. And so VIP is for that. And it was really interesting. It was a lot of new technologies, startup companies, a little bit of like, when you go to like, I guess maybe you've been there, like in New York when they've got like the concept cars at the car show kind of thing.
Right.
A lot of things that are just coming down the pipeline. So super interesting.
So maybe like a mini IDS.
Like a mini IDS.
Are you going to IDS this year?
I'm not going to IDS.
I am not going to IDS either. Dang it.
Yeah.
So before we get into things, we have to settle something really quick. Tell me about the 3 loves of your life.
The 3 loves of my life?
Yes.
I only have 2. Shoot. Actually, no, I've got 3. I've got 3. I maybe have 4. Can I have 4?
You can go there, but I don't think you know where I was headed.
I don't know where you're headed. So
I want to talk about your 2 kids and your husband. I mean, tell us about the 3 loves of your life. I want to hear about these 2.
Sorry, Rich. He didn't make the cut. He didn't make the cut.
Well, we always joke because Pam and I are both dog people, but and she's got an awesome husband who's about to finish Firefighter Academy, which is actually really cool. But okay, I got to hear about your puppies, and you got to tell everybody their names and where they came from because we got to hear about this.
Absolutely. No. So that they were my number 1 and number 2 loves tied, obviously, because you don't have favorites.
You can't have a favorite.
You can't have a favorite. But Senorita Diente is my number 1. It means Miss Tooth in Spanish.
Yes.
And then I've got Pandapple Martini. She is number 2.
And they are
Cavalier King Charles Spaniels. Yes.
Okay. Yeah. They're beautiful dogs. And anytime we have a video cast with Pam, I haven't seen Pandapple yet. Well, maybe she was just a puppy last we saw her, but Senorita's always on her little bed and in your room, and they're adorable dogs.
Oh my gosh, they're everything, and it's so funny. And I guess like this must be like what happens with children, that you have your first one and you're like, it doesn't get better than this. Like, how do I even get another one? So we ended up getting Pandapple because we got matched with Senorita originally. The breeder was like, she's really your dog. If you want her, take her. Like, we weren't planning on getting a dog that moment, and we left with Senorita. And you know how I feel about her. So when my breeder came back and said, I have the perfect dog for you, like, I took that really seriously, even though we were not prepared to get a dog. And in fact, I landed on a red eye. The breeder's in Connecticut. I landed on a red eye in New York. I made Rich drive from Massachusetts to New York to pick me up. And from New York City to Connecticut, I am telling him, you have one job, and it is to not get this dog. I said, I don't care. Like, she already knows I'm in. So like, I don't want to be bad cop. You need to be bad cop. I'm like, you can say it's the timing. We had Senorita in the car. Be like, Senorita doesn't like her. Just say something. Okay. Do not get this dog. So now we're there and I'm on the floor. He's on the floor and he's like, you got a leash? And I was like, what? We're leaving with a dog again. So sure enough, leaving with this dog. And I'm driving home and I'm thinking, there's no way I'm going to love her as much as I love Senorita. It's not possible. And they're so different, but in the best way.
Yeah.
And I've like head over heels fallen in love with her, but I've embraced how different they are. And again, it's like, I didn't think it got better, but definitely different could rival it.
I totally get it. It's funny because, you know, it- we're going to talk dentistry in a minute, but we can talk dogs for a minute. We've got three. We've got an inherited one from my father-in-law. We had one that passed away, and it's always like, you know, it's the dad's job to fix things. The dog passes away, everybody's sad. Dad goes out, and we get another dog. But it's funny because we did the same thing. My daughter, I was kind of looking around on the computer. We were not ready for another dog. Looking around on the computer, find this dog that's a breed that we had been looking at for quite some time. And it just happened to be like 15 minutes from our house, reputable breeder. So my daughter just begged, can we just go look at him, look at him, look at him? Yeah, we'll go look at him. And my wife the whole way is like, we're not getting a dog. We don't need a dog. We can look at the dog. That's it. First of all, you don't go look at a dog. You go to look at a dog to take a dog home. Okay. Especially if you're going to Connecticut, you're going to get a dog. I'm sorry. No matter what Rich says, you're coming home with a dog and you knew that. Well, anyhow, we go there and they just gave him a bath right before we got there. So he comes out, he's all fluffed up and he doesn't want to have a damn thing to do with us. And I'm like, this is going to be easy. And they set him on the floor. And then as soon as I'm about to stand up, he gets down on all fours and lowers his head to the ground and gives a little growl and jumps right in my daughter's lap. And I'm like, where's the paperwork? And my wife's looking at me. And it's so funny because that dog, he didn't have a name for about 3 weeks, but his name was Your Damn Dog for 3 weeks. Because my wife called me and guess what your damn dog did? Guess what your damn dog did? And now it's so funny because he's always on my wife and we don't have kids at home anymore. I mean, these are our kids, our 3 kids. So we got him and we got another, a puppy about a year later, which my daughter wanted a dog. We bought the dog and that dog is wild, but she is loving at the same time. So anyhow, I knew we were both dog people, so we couldn't go anywhere. And you know what? In dentistry, there's a lot of dog people,
Oh,
No
yeah.
offense to cat lovers, but there's a lot of dog people.
But you know what? You need to celebrate it too. So Senorita has her own Instagram page, which obviously Pandapple has infiltrated over time.
Yeah.
But do you know how many patients I get because of Senorita?
Do you really?
I do. I have people who found me on Facebook because of Senorita.
That is awesome.
I belong to Cavalier groups, and they're like, well, if you're a Cavalier person,
then
you can't be bad.
I'm gonna come.
And so Senorita sent me more patients than you can believe.
That is freaking hilarious. And I think that's kind of a great segue into dentistry. And you've had an interesting journey in dentistry.
I have.
You've been doing it for a little while.
Mm-hmm.
But tell us about your journey in dentistry and where you started and how you got to where you are now.
Okay, so I'll preface this with I was supposed to be a veterinarian. That was what was supposed to happen.
Okay.
So
you've always been a dog lover.
Yeah. Oh, yeah.
Okay.
Total animal person.
Yeah.
I wanted to, when it came to college, either major in ice hockey or something to
I
like go to
never
vet
knew that.
school.
I know a lot about you. I did not know that you wanted to major in ice hockey. Okay, so go ahead.
Okay. I was actually the only female in my ice hockey league.
Really?
I was. And
So
nobody
you were
would
like
fight
a
me.
badass.
Yeah. Nobody would fight me.
That is freaking awesome. Okay.
Yeah. I was a goalie. I used to try to pick fights because my
And
brother was on my team
where was this?
in New York.
In New York.
I
Okay.
played at Bear Mountain and West Point.
Okay, so you live close to the military academy?
About 45 minutes.
Okay.
Yeah.
Okay.
So yeah, so I played hockey like all throughout high school, and then I played in men's leagues in college. But that's really kind of what I wanted to do. I didn't really think about what I was going to do with my life, and when I did, I was like, I'll be a veterinarian because I love animals. So I started my college journey doing that. My dad's like, no, you can't do that. You're vet school, like you can do that, but it could take a long time.
Sure.
And a lot can happen.
Sure.
So you need a job to fall back up on.
Okay.
And so he made my sister become a dental hygienist
Okay.
and felt that dental hygiene was a good job for a woman, which it is. It's a good job for anybody.
Okay.
But he said, go be a dental hygienist, and then you can go pursue whatever you want after you get your dental hygiene degree. So I went to dental hygiene school, literally knowing nothing about teeth. All my friends were assistants and whatever. And I was so like not really into it. But because I had already been at that school, I was nominated to be class president. So I went from like, I don't even know anything about teeth to now I'm class president of the dental hygiene class. And I actually fell in love with it. I thought it was really interesting. I felt like I was going to school for a purpose. And then it was time to get my bachelor's. And I was like, well, path of least resistance is let's get my bachelor's in dental hygiene.
Yeah.
So I did that, still imagining that vet school might be a thing. But then I started practicing as a dental hygienist. And again, knew nothing about teeth. So the periodic exam was like riveting to me, which I know is like our bane of our existence most of our day.
Yeah.
But I just thought it was so interesting that if I spotted a problem, that was like a miracle. It was not a great hygienist. And the doctor would come up with a solution with the problem so quickly and so easily. And so I just thought that was interesting. And I felt like, well, maybe I could do this with my life. And so I was working for a GP. I was working for prosthodontists, not the best GP and really good prosthodontist. So I said, well, if I'm going to go to dental school, I have to be a prosthodontist because I want to be like them. Again, no dental experience. Looking back,
Sure.
probably would have loved general dentistry.
Yeah.
But that was sort of my blinders. And so I went into dental school feeling like I need to be a prosthodontist. And that's what I did.
So a lot of people say they were in school forever. You were truly in school forever.
Oh, yeah, till I was 30.
That's better than I would have anticipated with your career change. So, and I mean, you stayed within the same field, but their career changed. But one of the things that I think that you have, and I don't mean to criticize other dentists because quite honestly, I was in this boat too for a long time. And there was kind of a turning point in my career where this changed. But as a hygienist that became a prosthodontist, I know enough about you and your path and your past that you really have an emphasis in your practice on prevention and whole body health versus just oral health. So, do you think that that emphasis that is that fair to say? I mean, you have that okay.
That is very fair to say.
If you have that emphasis, do you think that that came from those periodic examinations, or is it something that you had before you even thought you wanted to be a dentist, or is it something that you think you learned in hygiene school?
I think it's a few things.
I'm sorry, as a hygienist.
No, I think it's a few things. I think having gone through hygiene school, I know what hygienists know. And they know a lot more than they're given credit for.
100%.
And they know a lot more than they're allowed to do, if you will, in their respective practices. So I had a pro fee practice before I got the right hygienists in place. And if you just have hygienists going through the motions and like schlepping through their day, not being productive, not getting patients healthier, then, that's not the best use of your hygienist.
Of course.
Your hygienist is not going to be empowered and motivated. And ultimately, your patients aren't healthy. And so I think that also, I mean, I can even say, like, maybe I'm a little lazy that I want my team to do everything that their license allows. I think it's more interesting to be able to do that than just kind of be in this little box of things that you're allowed to do. I want them to do everything that they can do. And ultimately, I want my patients to be healthy. I won't do bloody veneers. I don't do bloody composites. I don't do it. And really, the only way to do that is by not treating periodontally involved patients, getting them healthy before we initiate our care, but also having a partnership with your hygienist. And so you have to do it. And it's better for everybody involved.
I love that answer. But, and I'm going to say this too, that I admire you for knowing that you wanted to become a prosthodontist, because if I look back on my career, when I went to dental school, I thought I was going to be an oral surgeon. I mean, I was hell-bent on becoming an oral surgeon. And I realized real quickly, I shouldn't say real quickly, but I realized quickly enough that that's not really what I wanted to do. That wasn't my calling. And honestly, I think it was there was a big deterrent to, if I'm going to do it, I'm going to be an MD. And if I'm going to be an MD, that's 6 more years of school. And honestly, I don't know that I have it in me. I want to get out. I'm going to start a family. I want to do this. I want to do that. And then I thought endo. And then I realized that I wanted to do endo for the money. And it was like, okay, that's the wrong reason to do anything in your life. And I mean, that is what it is. I knew endodontists made a really nice living, and I'm like, hey, that sounds good. Yeah, let's do it. Of course, any young kid wants to make money, right? But one thing that I never looked into that I wish that I did was pros, because there's there was this stigma in dental school, and I think it's maybe the way that we started pros was that all prosthodontists do is dentures. And I don't mean that negatively, but the more that I've gotten into dentistry, I realize, there's a hell of a lot more that I don't think we were exposed to in dental school than dentures. And I'm like, there's these cases that I want to do, but I'm like, I always tell my patients, I'm like, I, I I'm your general dentist. If you went to your family practitioner and they told you that you needed heart surgery, are you going to have your family practitioner do it, or are you going to let them refer you to the cardiologist? Great analogy, because they all get it, right? Like, oh yeah, that's a good idea. But there are cases that I refer to the prosthodontist because I know that they're much more capable and much better trained to do so. It doesn't mean that general dentists aren't trained and the education that they get out of it, but I realized way too late that my calling was probably pros. And the funny thing is that even though I didn't want to do dentures all the time, call me crazy, that's one of my favorite things to do in dentistry. I think dentures are like so relaxing.
I do too.
And-
For so many reasons. So for starters, the anatomy dictates the whole thing.
yep.
So if you just let the anatomy guide you, you're going to make a really great denture. And also you have control over every aspect of that prosthesis.
100%. Yeah. And, we probably, I'm going to let you introduce your podcast in a minute, but I do want to ask this. Are you doing a lot of digital dentures now, or?
No, I'm not. And I
I'm
feel
not
like
either.
I
Okay.
feel like no, I'm like a dinosaur a little bit.
Mhm.
So you talk about picking your specialty. One of the
Yeah.
things that, besides having mentors that were prosthodontists, what I loved about pros? I feel like I'm a shopper. Like you buy something, you pay money for something, and you get something.
Yeah.
And so I felt like with some of the other specialties, you're paying money and you're losing something. And I felt like with pros, you're getting something tangible.
Yes.
And I felt like you're handing somebody something that, you pay for a denture and you can hold it in your
Yeah,
hand.
man.
And you could say, I
You
bought
get it.
this
Yeah.
versus
Yeah.
I lost this. And
Yeah.
so I felt like that was something that was attractive to me.
Well, for those out there, because I want to kind of zone in on this question, and maybe we'll close here, but let's redirect this podcast, and let's take it to a dental student, or maybe somebody that's recently out. I don't know how to really word this, but okay, here's how we're going to say this. Why would you encourage somebody to follow the path of prosthodontics versus the other specialties in dentistry?
Well, I can say that if you asked me this during pros, I'd probably have a totally different answer. But it's amazing what happens in those 3 years. For starters, you don't know what you don't know.
Yep.
And I learned very quickly. My first gold crown, for example, in dental school was on a second molar. It was on my aunt, and number 31. And I remember it took me 6 hours to deliver that crown
Yep.
because she had occlusal interferences and the whole thing was just a big old nightmare. My next gold crown was actually on my mom, same tooth. And I was taught to mount the cast in CR, and all of the mistakes that were made on the first crown turned into a crown that literally just dropped in.
right into place. Yep.
And for me, that was a light bulb moment, that you don't know what you don't know. And you don't want to learn things. I don't want to learn things when I'm in the heat of the moment, like pits are sweating, like
Mhm.
patients there, and I just didn't plan something properly. So for me, looking back, I feel like that doesn't really happen anymore, which is really nice. But also, as soon as I left residency, I was teaching at Tufts. I also joined a group practice and I became an expert out of the blue. I had dentists coming to me that graduated in the 80s looking for my opinion. They're like, well, you're a prosthodontist. I'm like, yeah, but you've been a dentist since the 80s.
Yeah.
Like, what can I teach you?
Mm-hmm.
And the reality is, the answer was a lot. There was a lot of things that I stumbled upon or took for granted in my residency that other people just didn't know.
Yeah.
And so I feel like I felt more equipped for private practice and I felt more equipped for any case that comes into my office. And that trajectory was so much easier for me than it would have been if I went the general path.
Do you do a lot of general dentistry as well in your practice, or?
I have a mix.
Yeah.
So I have patients where I'm their dentist.
Mhm.
So if they need a composite, but I mean, I've spent a stupid amount of time in CE learning composites.
Sure.
But yeah, so I mean, I will do direct restorative. I'll do indirect restorative all the way up to a full mouth rehab. Sometimes the patients are my patients. So I treat them. I tell them that they're treated at a multi-specialty level. You need a root canal, you go to the endodontist. You need an implant, you're going to the surgeon. So that's kind of the story there. But then I have patients that are sent to me by a GP. I treat them, for what we're doing and back they
Send
go.
it back.
Yeah. So I have a little bit of mix of everything.
I love that. We're a multi-specialty practice. Well, I mean, we are in a multi-specialty practice, but we treat multidisciplinary within our practice. There's a lot of things that we know what we're good at and we know where we're not, and in order to do everything in general dentistry, you have to keep a lot of inventory and you have to take a lot of education to maintain, to be current and up to date and what's going on in the world. And sometimes that's hard. So, I always tell dentists, focus on what you're good at and the rest will come,
And what you like.
and what you
look
like.
forward
Yeah,
to.
absolutely. Absolutely. I mean, I know that we both love class 2 DOBs on 15 with a patient that can't open their mouth. I mean,
Always.
favorite thing to do.
Sign me up.
Sign me up. So as we close, though, I do want to let you talk about your awesome podcast. So promote that for a minute. Tell us about your podcast and who you do it with, and tell us a little bit about it.
So I do it with your number one favorite person, David Rice.
That was a lie.
Oh my gosh. Yes, definitely a lie.
Yeah.
A lie.
Still out there. Screw that guy.
I know,
Yeah.
right? No, it's so much fun. So the purpose of the spirit of our podcast is, you're at a conference, say like this,
Mhm.
and you're sitting through CE and you're learning science and you're learning clinical applications and you're learning from a lecturer. But then when does the magic happen, right? It's after the course. You're sitting down, having a glass of wine with your friend.
It's the
and
CE after the CE.
the CE after the CE,
Yep.
and having those real conversations. And sometimes you got to push back on some topics.
Yep.
That's what Dentistry Unmasked is about. It's for us to really try to uncover truths within dentistry. And so we do that by just having conversations with our friends and trusted experts in the industry. It's so much fun.
I love it. So, folks, Dentistry Unmasked is the name of the podcast, and it is available on wherever you download your podcasts. Pam and David, they're great friends, great leaders in the industry, and it's just an honor to know you, an honor to have spent time with you. But I'm going to call this the moral of the story is follow your passion, and I'm also going to say you're never too old to follow it. If you still want to do what you love, do what you like, stick with it. So thanks, Pam.
Thank you.
That was a lot of fun.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.